I've never laid there and just had like an orgasm fall on me. You know what I mean? Like it's just...
Sex education in this country and around the world is paltry at best. We're just expected to know how to have sex. Most parents don't talk to their kids about it in any sort of meaningful way.
Are we seeing people with more dysfunction younger?
Certainly we are seeing a little bit more in younger people. You watch porn and you think this is what sex is going to be like, or this is what sex should be like, and maybe I'm inadequate. A lot of people will think sexual dysfunction is just because of low testosterone. It's not the case. High blood pressure and diabetes, they're rampant in the United States, and they are the cause of all these issues for the large majority of people. Low sexual desire is actually very, very common. If you look at the data, it's like 40% of women experience low sexual desire. However, only...
Hi everyone, I'm Gabby Reece. I'm a retired professional volleyball player and co-founder of XPT Fitness and Laird Superfoods. On this podcast, we interview experts about the latest, whether it's in wellness, health, fitness, so you can maximize performance in all areas of your busy life. I know how crazy it can be. And today I'm joined by urologist and pelvic surgeon, Dr. Rena Malik. Dr. Malik is an expert in human sexuality and sex health. I wanted to bring her today because I really want to dispel myths about sex and to answer questions that seem to constantly pervade our society. It's funny, we think about sex, but we don't seem to really talk about it that much. And we discuss on this show the importance of sex education, solutions for sexual dysfunction, and break down common sex myths. Make sure you listen through to the end when we talk about whether it's vital to a man's health to ejaculate less as they get older. It's been an interesting topic in my house. Welcome to the Gabby Reece Show. Let's go. Dr. Rena Malik, welcome to the show.
Thank you so much for having me.
I want to jump right in because there's a lot to cover. You know, sex is obviously a big topic. And when I think about it, so I've been married for 27 years with the same person for 29 years. And it's so interesting how biologically, right? All we do is think about sex. Everything kind of gears towards like getting sex, having sex, looking sexy, being desired. And in a way, it like takes a few minutes. It doesn't happen, it happens as often as people can get it in or want it. And it's just this powerful driver that is so ingrained in us, in our culture. And yet I feel like we know almost so little about it. And it's also, for me, something that we've overcomplicated, but that, again, physiologically, like we don't understand it enough. So it's this weird push and pull all the time that I sort of feel like, hey, this is appropriate to have that kind of all around this very interesting act of sex and sex health.
Absolutely. I mean, I think that sex education in this country and around the world is paltry at best, and if there's any at all. And we're just expected to know how to have sex, right? Like you are just supposed to figure it out. There's no guidance. Most parents don't talk to their kids about it in any sort of meaningful way. School doesn't teach you your anatomy. You don't even get told the anatomy as kids, right? Your parents are like, it's your hoo-ha or your special place or down there or whatever name they give it, right? But it's like they don't even know the words. So how can they be expected to, like, first of all, know what's what? And especially for females. And then, when they're with a partner, like, what are they supposed to do and how are they supposed to respond? The only true visuals of it they see are in media or erotic film, none of which are accurate. And leads to a lot of dissatisfaction and shame and feeling like you're broken because things aren't working the way that they are portrayed on TV.
I thought it was extra fun that you like your culture, you're a female, you decide to go into sex health, you're a urologist, all of these things, but where did you get it within inside of you to be completely comfortable and open about sex? Because I feel like it's the healthiest way is not to make it taboo, but then somehow how do you do both, right? It's that push and pull. How do you make it this sacred, beautiful thing? But then it's this sort of really natural sort of organic thing. Were you always like that?
No, no, not at all. So culturally, like we didn't talk about sex. I didn't know like how, we didn't get taught about the clitoris or our anatomy, or I knew very little. Let's be honest, I knew very, very little. And part of the interest in learning about it was because like, after you have your first orgasm, you're like, holy crap, no one told me about this. Like, how did I not know? How did no one tell me that I was deserving of this kind of pleasure and that sex wasn't all just penetration and, all for the man, right? Like, yeah, of course, sex feels good even if you don't climax. I'm not saying the be all end all is an orgasm, but, I think that you sort of like, that's part of it, right? Like there was so much quiet about sex. Like you never talked about it. Like, oh, the thought of, my parents even talking to me about sex would be like crazy. Cause in South Asian culture, even though we wrote the Kama Sutra, like no one talks about sex, right? No one talks about it. You're not supposed to have sex before you're married. And then you're just supposed to magically know how to do it. Like I have a good friend who was like, yeah, I was getting married. And on my wedding day, my mom comes up to me. Clearly, I've been having sex with my partner, but she doesn't know that. And she's like, honey, do you need me to talk to you about anything? And she's like, no, please don't talk to me about anything. But like literally on her wedding day, she's trying to have this conversation with her, right? So there's that. And then as I, when I chose my specialty, I was really interested in surgery, and I looked at the subspecialties of surgery, and I was like, okay, what do people deal with that's like the most annoying thing? And I decided between ENT, which is ear, nose, and throat, and urology. And I was like, this stuff is gross, like spit. I don't like that. But I was like, urine and genitals, like I'm okay with that. Like I don't have a problem with that. And so I started there. And then as I started talking to patients and taking care of men and women with sexual dysfunction, I mean, like I could just see them release when they finally were able to share their frustrations and how much they had held that in, and how much I made a difference just by talking to them about what was going on with them, not even fixing their problem, but even just having someone to talk to about it. And then being able to say like, hey, you don't have to suffer in silence, or, hey, that's normal, or that's not normal, but we can fix it, is like the most freeing thing. And I think personally, it impacts people's quality of life way more than a lot of other things that we do in healthcare, right? And so it just became a really important part of my life. And I think it's so valuable for people to feel self-confident, to feel comfortable with their bodies, to know how to pleasure themselves, to know how to pleasure others. I mean, these are powerful things that you take with you for your whole life. Like whether you're in long-term relationships like you and me, whether you're dating, things are always evolving, and you need to be able to communicate about sex. You need to be able to know what you like. And if you don't know those basic tenets, you're never going to have good sex, and you're never going to feel comfortable in your own skin.
I always think, and we'll go deeper into it, but I always think it's also fascinating as you are in a relationship with somebody, how you would then add or change where you would get that voice and feel comfortable. It's like the person who knows you the best. And yet even within that dynamic, you can be timid in saying, I would like this, or could we try that? So it is interesting how there is this weird shame or modesty sometimes put around something that even people experience in long-term, comfortable, healthy relationships. If you had a magic wand, I'd like to start with the education part first, just with young people. And obviously, it's going to vary kid to kid and house to house, and there's sort of a personal touch to things. But if you had a magic wand and you kind of said, hey, a larger swath of, boys and girls at which age, and what does that look like to start that conversation? And then at what ages, because I have 3 daughters, and they're big, they're young adults, and my youngest is a senior in high school, and then at what point do you start getting more specific? Like, hey, your own pleasuring yourself, that dialogue around that. Because I'm sure you've talked to so many people and that you have an idea about if people could just do sort of these 4 or 5 things, this would really help your kids out.
Yeah, so I think there's never too early to start talking about the basics, right? So when your kid is old enough to understand, telling them what their parts are, right? That's like a basic thing that you should never teach them some other name. They should know vagina, vulva, penis. Like they should know those basic terms so that if God forbid something is going on down there or something happened, they can tell you exactly what happened, right? They have terms to explain those things to you. So that's first and foremost. Then as they age, they will be curious, right? You may catch them touching themselves. You may catch them masturbating and they don't even know what they're doing, right? It's a self-soothing behavior. And so how you react is really, really important. So first off, not giving them shame, like, oh my God, what are you doing? How could you do that? Like just making them feel like that's going to care. You don't realize how powerful that is for them to hear you as their parental figure, their authority figure say like, oh, don't do that, right? Because now you've already created a space of shame, right? And then, if you do see them do that, it's reasonable to say like, okay, that's okay to do. Just you do that in private. We just don't do that in public. You don't do it in the living room. You go in your room and do that. That's first and foremost. And then as they start getting older, I tell parents, like on average, kids are seeing pornography at the age of 10. Now that means that some kids are seeing it earlier than 10. And it's not because their parents are giving them access to the computers. Parents are very thoughtful, right? They put all these secure guards on their computers. Schools are very thoughtful, but there's a lot of places where they may access it, right? Some friend may have a phone, whatever. Or like one time I was at a library and I saw somebody watching porn on a public computer, right? Like you never know where they're going to see it. And yeah, I'm sure someone saw him and said, excuse me, sir, you can't do that. But there was a moment where I caught him, right? And so like, you never know where they're going to come across this. And so having like the important discussion with them about like, hey, first of all, like what happened with me, and I'll just be honest, I tell the story a lot. My son asked me like, what is sex? And I said, okay, I'm not really equipped right now to give you the answer I want to give you. So I'm going to talk to you about this, soon, but not right this second. Like, give me a few minutes to like think about how I want to respond, and maybe we'll go for a walk and talk about it. Because even me as a sex educator, a doctor, was like, okay, I need to think about how I'm going to approach this with my son. Each kid is individual, right? So we then went for a walk. I told him like, this is what sex is. This is the act of sex. And he was sort of confused. He's like, wait, that feels good. Like, what is that? Like, he didn't know, right? He doesn't know what it is. And so I was like, yeah, some people find it pleasurable. It's a serious thing. We do it with somebody. Like we had a whole conversation about it, but it wasn't one conversation. It's not the birds and the bees and we're done, right? I said, look, this is the first time we're talking about it. You're going to have more questions. And as they come up, I want you to feel comfortable to ask me them anytime, right? Like feel free to talk to me about it, no matter how weird or uncomfortable you think it is. Like I'm always going to answer you. I'm always going to tell you the truth. I'm never going to lie to you. And I think that's just like the building block, because they're going to have their own questions. And sometimes you'll be like, wow, I never even thought that could be a question, because you probably had it too, but you don't remember having it, right? And then I think, as they age and they start getting in relationships or they start being curious, I think you may notice like, oh, they close the door more often, or they want their alone time and they may be masturbating, right? And so at that point, it may be reasonable to just be like, hey, like if you're doing this, and I have no judgment if you are, like this is a normal behavior and it is, something that people do to help them feel good. And that's fine as long as you find yourself like not avoiding other activities because of it, right? And there's a small subset of people who find themselves really addicted, even young kids, right? Where they are like really into masturbating or pornography and they're struggling with it. And so I think just if you find that issue, like talk to me about it, like we'll work through it together, but just saying this is normal. It's a normal behavior. It's totally fine to do, like just sort of being open for them and saying, I'm here for you so that you can come to me and ask questions rather than going on a mainstream pornography site to learn, or talking to your friend who has no idea what they're talking about either, and learning things that are not necessarily indicative of real sex or real intimacy.
This podcast has been brought to you by Laird Superfood. This is a brand that's very easy for me to talk about because it was created in my kitchen by accident by my husband, Laird, with the idea of, hey, if I'm doing something every day, like drinking coffee, could I do it in a way that it was more supportive, healthier? And lo and behold, Laird Superfood was born. We have creamers with adaptogens in them. We have a delicious coffee. We've got bars, and we have an entire instant category that I love. It's one of my favorites. It's like the unsung hero of the brand. And what this is it's the product already combined. So coffees and creamers, or an instant mocha, instant latte, instant maca latte. If you're not a coffee drinker, I have an Insta Chai, Insta Matcha. All you do is add hot water. So if you're on the go or back in the office, or hopefully maybe even just adventuring somewhere outside, this product is so seamless, delicious, easy to use. The other thing about this brand that's very important, not only, of course, we don't use artificial flavors, but no natural flavors either. And it's not that easy to do. It's hard to do. And it's something I'm really, really proud of that we do at the brand. So if you've been curious about Laird Superfood, maybe you want to try our bars, hydrate products, just add water, freeze-dried coconut. All you have to do is go to lairdsuperfood.com. And if you put in the code GABBY20, you'll get 20% off your entire order. That's lairdsuperfood.com. And don't forget your code Gabby, Gabby, 20 for your savings. That's LAIRDSUPERFOOD.com. And your discount code is Gabby20. Yeah, and it's so interesting as parents, and even though we think of ourselves as progressive or we'll do it different than our parents, I do think we still have a hard time thinking of our children as sexual beings. It's like, it's still this very, even though that's what you want for them, right? To make that a really healthy expression of their own. No matter, I think, how cool you are, it's like, oh yeah, that's right. You're going to have that side of yourself. And, it's interesting. I have one daughter in particular who's grown now. And I remember thinking when she was like 13, I thought to myself, this kid by nature is much more provocative than I am. And, I thought, oh, it's so interesting to figure out how I'm going to parent her, for her to be comfortable with sort of her language and her exploration. So that was a real education, for me, the ongoing education as a parent. And I sort of feel like we treat boys differently than girls. It's this whole idea of, well, and the fact is also the biological responsibility. I mean, if a girl isn't really understanding what's going on with sex in different ways, the consequences, obviously very different to her. So I think that that's another part of it. I think a lot of times you'll live in a home where people are trying to hope that maybe the kid will push it off as long as they can, so they make the choice that they want, versus, just some weird dynamic, or they're partying with their friends and something weird happens, or they're trying to prove something, or just whatever. So I think a lot of that shame and guilt versus, making that story of, hey, at the right time, in the right circumstances, it's a really healthy and great, thing.
Yeah, I think nobody wants to think about their kids engaging in sexual activity, especially prematurely. But let's be real. They're not fully developed. Their brains are not fully developed. We can't be there to hold their hands every moment of every day. They're going to go to parties. They're going to have moments where they have to make decisions. And so we just have to give them the tools to make the right decision for them, right? And be safe. And so, of course, safe sex comes into the discussion. I think it's foolish to bury your head in the sand and think they're not going to have sex. If they don't until they're older, great. That's wonderful, right? Like good on them and good on you for waiting till they were old enough to make a better informed decision about who they want to do that with. But let's be real, like their kids, their hormones are raging, right? Like they go through that experience and they're really attracted to people of the other gender, and it's evolutionary, right? Like they're fertile and they're like young. And so like it's going to happen where they want it. Now, whether they do it or not is a different story. Yeah.
So a lot of times people think about sex and they think of it just as this physical thing, and it's, it's obviously, it's so complicated, all the things that impact sex. So you do have your, your physical physiology, your hormones, but you also, your brain, the neurological aspect. So when people come to see you, let's say with some type of dysfunction. First of all, are we seeing people with more dysfunction younger than we were, let's say 25 years ago because of technology and porn and stress? Or, you know, what's the conversation in the profession about how sexual dysfunction is changing?
Yeah, I think certainly we are seeing a little bit more in younger people. I think it's not the porn itself, it's what the expectations are after you watch porn, right? You watch porn and you think this is what sex is going to be like, or this is what sex should be like, and maybe I'm inadequate in some way. Either I'm not responding the way that I should, my partner's not responding the way that I should, it's not lasting as long as it is in pornography, whatever it is. But like, you're young and it could be your first time having sex. It could be your, or it could be your fifth or sixth time, but it's a very different experience. And you just don't know enough of what is normal. Again, because you're not talking about it. Your partner's not telling you what they like. You're not telling your partner what they like. There may be a lack of discussion of consent around some things. There's actually an increase in choking behaviors in this younger age group, more so than we've ever seen in the recent past. Likely, we think because of pornography, them now thinking that it's like as normal as kissing. And that's fine if they're into it, but it's not safe necessarily. It can be dangerous. And you definitely need consent, right? So I think that those sorts of things we are seeing, and this leads to a lot of psychogenic sexual dysfunction, right? So people get stressed around sex. And when you're stressed around sex or anxious or thinking about, is my penis going to be erect? Am I going to orgasm? Is it going to, like, what is it going to feel? Is it going to hurt? Whatever stress it is around sex that you're experiencing, you will then not be able to. Let's say, for example, for men, you're stressed about getting an erection. You're stressed. Is it gonna happen? It doesn't happen because you're stressed. Now, the next time you have sex, that stress is even higher, and just vicious cycle. Same thing for women. Oh, am I going to climax? You're so focused on, am I going to climax, that you don't climax. And then the next time you're even more stressed about it. So you can't be in the moment. And, I would argue that your brain is such a huge, important part of sex, probably the most important sex organ we have. Because if you're not in the moment and you're not present and you're not enjoying the experience because you're thinking about something else, you're just not going to it's not going to be a good outcome, right? It might be mediocre or it might be bad, but it's certainly not going to be a great outcome. And I think part of it is, like a lot of, especially when you're younger, because we're talking about younger people, there's a lot of body image issues. There's a lot of concerns about how I look, how I smell, how I taste, whatever it is, that become very prominent in their mind. They're very worried about it instead of being really focused on actually enjoying the task at hand.
Yeah. And you say task at hand, but it's funny because it is this great act, but in a way, and I think it's true for both sides, like you have to concentrate a little. Like I've never laid there and just had like an orgasm fall on me. You know what I mean? Like it's just, it's like you gotta get involved a little. So let's talk about not the easier part, but the physiological. So, one of the things I appreciate is how lifestyle comes back to the center of our health and in every aspect of our health. And, you talk a lot about the importance of exercise and food and sleep. And most people probably roll their eyes and think, oh yeah, but you're like, but it could impact your ability to have an orgasm or have an erection and things like that. So was that an unpopular thing for you to bring into your practice, or was it just kind of the natural part of the education?
No, I think, I sort of got sick of how you would come to the office and, when I was working in a private practice or at academics, I would see patients, I would have like 15 to 30 minutes with a patient. So you'd talk to them, you'd be like, here's medication for your ED, but you knew they had diabetes, they had high blood pressure, they were not eating right, they were not moving their bodies. but you could not fit all of that into that time frame, right? And so, I would do my best, but I realized like we cannot fix this problem. Right? People are like, oh, I don't want to just take pills. Well, there's no easy out, right? If you want to fix your genitals, and the reason this is important, right, is you need good blood flow to the genitals, you need good hormone function, you need good nervous system, you need, and those things rely on good health, the foundations of health, right? In order to have good blood flow, you can't have high blood pressure, you can't have diabetes, you can't have high cholesterol. And that's one that people like right now are like, oh, cholesterol's not a big deal. No, it's a big deal. It will cause your dick to stop working. It will cause you to have less intense orgasms. It will decrease blood flow to the genitals, right? Like it will do that. And then the sequelae of having decreased blood flow will be there. And there's no denying, you're going to see it there before you see it in your heart, before you see it in your brain, before you have a heart attack or a stroke. You're going to see it there first. And so you got to work on those things with exercise. In fact, there's been studies that have shown that 150 minutes of aerobic exercise a week are as good as taking a Viagra for men with erectile dysfunction. And so aerobic exercise is important. Resistance training is so important for hormonal health. So in doing 2 days a week, at least, of heavy resistance training on the large muscle groups is really important for testosterone for both men and women. And to maintain good hormonal function. And then, I think really like avoiding those comorbid conditions, those are the death of us, like high blood pressure and diabetes. They're rampant in the United States, and they are the cause of all these issues for the large majority of people. A lot of people will think it's just because of low testosterone. That's not the case. I mean, testosterone is certainly a part of it, but the cause of issues with sexual function due to hormones are a small subset. There's a lot more there that we need to deal with, and a lot of it is vascular, and a lot of it is psychogenic, like dealing with the psychological issues. Because the first time you have a problem in the bedroom, it's on your mind, whether it's physiologic or not, right? Whether it's because of blood flow issues, or because you had a bad day, or because you were stressed, or because you didn't sleep well, or because you were thinking about 10 other things that you had to do. Now you're like, oh no, something's wrong with me. And you're thinking about it the next time. So it's always there with you, no matter whether it's a biologic problem or a psychological problem, it's there. Like you're going to be thinking about it. And so you got to work through that.
Yeah, I would almost think the psychological would be harder because it's those intangible invisibles, like, well, am I stressed? And even about the relationship, like, are there things that we need to talk about and we need to address because it's actually showing up in our bedroom? And that must be very interesting when you have a patient come to you, and you might, I would imagine after all this time, get the sense that this is actually a conversation issue. This isn't a pill or exercise problem or a testosterone problem.
Yeah, I mean, I think there's, like I said, there's always a little bit of A and B for most people. There's always sex therapy work that can be helpful, especially when you're talking about couples. Like when you've been together for a long period of time, there's going to be relationship issues here and there. There's going to be ups and downs. Someone's desire may be higher, someone's may be lower at that particular time in the relationship. And that's very common, very, very common. And it's sort of like, how do you navigate that, right? And also like, how do you navigate those stressors so that when you're in the mood to have sex, sex can just be sex. Sex can be playful. Sex can be fun. Sex can be a time to relieve stress, not to like think about all those relationship issues, right? Like how can you get yourself in the mood for sex? How can you be mindful during sex? And like those things can be transformative, like set the mood, like whatever it is for you, whether it's like taking a bath or putting on certain lighting or certain music or candles, whatever. And foreplay like starts in the bedroom, right? I think the other issue is like, we're like, oh, it's time for sex. Like I got to turn myself on right now. But like, it has to be a process, right? Like you got to sort of like, it starts like we say, it starts at breakfast, like with a touch here or there, or flirty text or whatever it is, like just making someone feel desired. And so that people want to have sex that's worth having, but they also want to feel desired so that they can actually be turned on, right? Like it's going to take some work for some people. It's not immediate like you see on TV where you see your partner and you're like, damn, I want to jump them, and you go and have sex. Like that's like, yeah, when you're younger, sure. But as you've been in longer term relationships, it takes a little bit more, and that's okay. That's called responsive desire. You have to be aroused a little bit, and then you're like, oh yeah, I like this. I remember I used to want this and now I want it. But like you have to get there. And that's okay. So I think, there's a lot of things that people can do to improve their sex lives, but it's like, you got to look at it from the big picture approach. Medications have their role. Like sometimes they can really help people get their confidence back when they're struggling. And then once they get their confidence back, they can work through all the other issues and then they feel great. And then they can maybe get off that medication later on. Or they can get off the medication when they've fixed their health, right? They've gotten better eating habits. They're working out. They're doing all the things they need to do to optimize their overall health. And they're like, okay, yeah, I don't need this anymore, but I just needed it to help get me through this certain time. So everything has a role and everyone is really individual. But I think, the biggest thing I can say is like, don't make it so serious, right? Like sex is supposed to be fun. It's supposed to be playful and you got to be able to talk about it. So even in long-term relationships, you mentioned like, oh, it can be hard. Yeah, absolutely. It can be hard because you're like, oh, we've been doing it the same way every time. It's like vanilla ice cream. It's always good, but sometimes a little boring. You know what I mean? And so you're like, okay, maybe I want to change it up. So how do we do that? Right. And it doesn't have to be like, let's get out the whips and chains and like, change it up 180 degrees. It can be as simple as like, let's have sex somewhere else in the house, right? Or let's have it at a different time, or like, let's have a night for intimacy where sex is on the table. We're not like going out to eat and getting bloated and feeling tired. Like, let's be together. Let's be physically close. And if sex happens, that's great. But like, let's prioritize that in our relationship so that we can have that intimate, amazing sex that we used to have when we started dating or when we were, young and married.
Yeah. And I think it's interesting where you someone listening to this, maybe if you have small children, you have 2 children. It's like when your kids are little, I used to joke, it's sort of like get it when you can. I didn't put a big, I didn't have huge expectations around it. I think it's also unfair to do that to ourselves where we compare either, 10 years, 20 years into our marriage to a movie or to before we had children that are, they, notice how they are incredible at knocking on your door right when things are kind of moving in that direction. My husband used to joke that it's because they're competitive and they don't want any other babies coming. And it's like, he goes, it's uncanny. It's like they sense it. You finally like maybe everybody's warming up and it'd be like, at the door and you're just like, is that for real? Like they ignore you. But I think it's that too. When you talk about being playful, but being realistic, it's sort of like if you just had a baby, for example, you don't expect yourself to be in the shape of your life. And it's the same thing. It's like, hey, if you have little kids running around, everybody's tired, it's not, and sometimes it's not a sexy time.
Yeah.
Right.
Yeah.
Like if you're nursing and there's diapers and there's all these things. So I always think it's important if people go, okay, based on where we're at, how could we connect that both people would feel satisfied?
Absolutely. And I think that that's so important, right? Like, yes, like we as women have very different challenges when we have babies, right? We often feel touched out, like we're holding them all the time, breastfeeding, all these things. And you're like, oh, the idea of like cuddling and being intimate, like in that way is a huge turnoff. But like, okay, I could have sex like quickly. You know what I mean? Like I could do that.
Yep.
But like your partner may not know that. And you guys may have always had this really touchy feely, like warm up foreplay. And it's like, if you don't tell them, they can't read your mind and vice versa. If men are frustrated because they're not getting what they want, they have to be open about it, right? Like no one's reading anyone's mind just because you've been married 20, 30, 40 years. Like people change, their thoughts are changing. Like no one can read your mind about like what is going on in your head, in particular with sex. And I think the other issue is when you bring up sex with a partner, new partner, old partner, there's so much emotion behind it. So realizing like, say you're not happy about something in your relationship with sexually, like it's not going to be one conversation. It's not going to be one and done. Like, let's sit down and have this serious conversation and we're going to like ham it all out, because likely the other person's like, I've never talked about sex with you. And now all of a sudden we're having this major conversation and there's a lot for me. So they might shut down or they might be like, oh, everything's fine, and just like sort of dismiss you. But like realizing that like, that's not about you. That's about them. That's how they're responding to that. And just like, okay, like when would be a good time to talk about this? Like, it's important to me. So like, can we just plan to make some time to talk about this, maybe for a few minutes one day, and sort of like easing your way in. And, you know, everyone has to give a little in terms of like how you realize you communicate with your partner. Oftentimes, unfortunately, men don't get taught communication as well as women, right? They don't learn to express their emotions the same way. Hopefully that's changing with our younger generation, but like, they're taught to be men and be quiet and just deal with their problems. And so like, they don't want to talk to you about it. They don't want to bring it up. And so like, it's sometimes a little bit of both and vice versa. If you talk to them or they talk to you, one of you may feel like you're getting attacked, like something's wrong with you. And then you're on the defensive. So like, just realizing like, it's not easy. And sometimes having a sex therapist available who can help you talk through those things, like a neutral party, can be really, really helpful.
And I feel like people actually feel more similar. They just don't know how to get there. I will say if you are a nursing mother, you could wear a bra, and this way, because it's like the last thing you want is one more person touching your breasts, and yet nobody hates, like, bras can be sexy, but it's just like, like just look at them, maybe, grab the outside, but let's just keep it like stay away. I mean,
yeah.
So when you talk about the hormone aspects, everybody thinks about testosterone, but estrogen is a very important hormone for sexual health and for both men and women.
Absolutely. Absolutely. So in terms of, we'll start with women. In terms of women, because that's more common in terms of estrogen, is as women go through menopause, they have a dramatic decrease in their estrogen levels, right? As well as their progesterone and their testosterone, which actually they have more testosterone in their bodies than they do estrogen. So everything starts to decline and you're like, I know, I'm well aware.
I know.
But so, and everyone responds to this a bit differently, but some people develop very bad hot flashes, sleep disturbances, mood changes, even skin changes, musculoskeletal changes. There's a whole bunch of things. I mean, if you look at like the number of symptoms you can have during menopause, it's like a laundry list. But some of them can be related to desire and your actual vulva changes. So when you go through menopause, because the estrogen content drops so low, your vulva changes. So the pH inside the vagina becomes higher, which makes you more likely to get recurrent urinary tract infections. Your vulva, the lips of the vagina, of the vulva start shrinking. The labia minora start shrinking. The clitoral hood can even shrink back a little bit. The clitoris itself can get smaller. So like literally your whole vulva is changing due to estrogen. It can become less lubricated, less moist, so that you start feeling pain with sex or discomfort with sex. So all those things taken together can make for really sex not being very comfortable. So if you're not sort of being proactive, sometimes that can become very uncomfortable. But there's a lot of things we can do to help with that, whether it's hormone related or non-hormone related, to help sort of maintain the tissues down there, prevent UTIs, all those sorts of things. With desire, we often see it also declining because of that testosterone going down. So low sexual desire is actually very, very common. If you look at the data, it's like 40% of women experience low sexual desire. However, only 12% are really bothered by it. Now, bothered could be you bothered could be your partner bothered, but just to know that there are actually treatments available for that. We have 2 on-label FDA approved options for low sexual desire, as well as off-label testosterone that can help with desire. But of course, these are options after you've dealt with relationship issues, stress, everything else that's going on, lack of sleep because of your hot flashes, right? Like everything else that's going on that's contributing to desire, because desire is really complex. It's not just hormones, right? It's like, how's stress in life? How's relationship? How's what am I supposed to be doing? Am I supposed to be taking care of my kids, taking care of my aging parents? Like all these things that happen during midlife on top of menopause, which can all affect desire. And so you got to sort of look at the big picture of what's available, what's going on, but also know that like, yeah, there are these things available to you that can help, whether they're hormonal or not, to really improve your symptoms and improve your quality of life and improve your sex life.
Yeah, it's interesting how because of all those factors, how it almost starts to just, for a lot of people, it just sorts of drift out and disappear. And you often wonder, have they talked about it with their partner? Has there been a real conversation around it? Because it is a part of the relationship. And I've heard you say this a lot, like as long as the couple is on the same page about how often and, how, or, how we're connecting, that's really the most important thing. So I think it's such an important, you wouldn't think it, but it's to keep talking about it. Now, what about, for women, it's like, we don't realize that like our clitoris is like their penis. I mean, kind of, as far as on our body, what would be similar to on their body. And
it's homologous, actually. So when you're a fetus, it's called the genital tubercle. And as you differentiate to become a boy, that becomes a penis. And in a woman, it becomes a clitoris. And if you actually cut them on an anatomical section, like to study anatomy, they're identical. Two spongy cylinders filled with these spaces that fill with blood. And they have the same arterial blood flow in, the same nerve structure. Everything looks identical. And so in women, you only see the head of the clitoris, but it actually goes deep into the pelvis and then around the vaginal canal. So it's actually much longer, and, there's much more to stimulate there. It's just not visible to the naked eye like the male penis. So yeah, very, very similar. And usually the most reliable route for orgasm for women is through the clitoris, just like the penis is for the man.
Are there women who can have an orgasm without someone touching their, I mean, I know I've heard stories, stories about people who, they could have an orgasm with someone touching their breasts. So I would imagine, is there a way that they can do it with, I'm always amazed about those women with only their vagina and not their clitoris.
Yes, there are, because if you're stimulating, I mean, so just like, you can have an orgasm from any real area of the body, any erogenous zone. If you build up sort of a tension and then a strong release, your body can respond with an orgasm. It doesn't necessarily have to be with stimulation of the clitoris, but that does take like very intense focus, probably some practice. And if you can't, that's okay, right? Like, who cares, as long as you are feeling pleasure and achieving climax however you like. Like, it's not a superpower if you can't. It's not a superpower if it's just something that you can do, right? That's fine. I mean, some people may not want to just orgasm from breast touching, like there needs, because then what if you're like, okay, I'm done, that's it. Like, so I think, not always to think of like, oh, I'm so jealous of that person, because they have their own issues potentially, right? And so, but the other thing is, because the clitoris extends into the pelvis, like if you're stimulating the top side of the vagina, which people call the G spot, it's actually the G zone. It's a zone, an area where the shaft of the clitoris is, right? That's like the shaft of the penis. People can stimulate, can actually achieve orgasm through that. So some women can achieve climax through just stimulation of those tissues through either finger or penetrative sex. Usually there's probably like a smaller gap between the clitoris and the vagina. They've done some measurement studies on that, but ultimately, like, yes, they can. There are people who can. There's also different nerve endings. So the clitoris goes to a different nerve, the G zone goes to a different nerve, and the cervix goes to a different nerve. So you can get different sort of orgasms through stimulation of different nerves, basically. And they sometimes feel different. Like, people will describe a cervical orgasm as like shooting stars, or like a cosmic feeling, so to speak. But really, interestingly, I just had an interview with a sex researcher who said that it was interesting. They were studying these people who claimed to have, that was not the purpose of the study, but they claimed to have multiple orgasms. And what happened was they only had the characteristic orgasm findings of like pelvic muscle contractions every 0.8 seconds, which is sort of how they define an orgasm. Like, you feel that throbbing of the pelvic floor muscles, but they were measuring it through probes, that they only saw it once. But there were other times where the patient perceived they were having orgasms. So who knows if they're really having orgasms or they're feeling like a really intense pleasure, which is great, right? Like, but it may not be that true orgasm which we think of. So again, it's hard to say.
Because we're talking about women. Let's say there's a woman and she's either, she's had children, or she's of a certain age, and, for all the factors that keep us from being either desiring of sex, or sex is painful, or enjoying sex. Between kind of best lifestyle practices, and if it's a interpersonal relationship issue, sex therapy, lubrications. Is there also, once they kind of get their hormones set a little bit back on track, can they have their kind of sexual appetite resurrected, and even the comfort of it and all of the things available to them?
Absolutely. You know, I think there's the same things that we tell men will affect erections, probably affect clitoral blood flow too. So those things are going to be, you know, you may notice that your orgasms are less intense because maybe there's less blood flow because you've got high blood pressure or cholesterol or diabetes or, you know, you smoke, right? Like those things can still affect the clitoris, whether you're on hormones or not. But you may notice that those, you know, so you still have to fix those issues. But yes, you can absolutely get, you know, healthy vaginal mucosa with normal lubrication. You can maintain the, you know, the health of the vaginal tissues so they still expand and are as flexible as they used to be. Your libido can increase back to normal if you're, you know, say there is a hormonal component. So if your testosterone is very low or you're, you know, going through menopause and you hormone replacement can help with the hot flashes and the other things that can sometimes all contribute to lack of sleep and other issues that are really affecting quality of life, right? So absolutely, you can get back to normal, but it's not like, oh, I'm going to take this one thing and everything's going to be great. Like you see these ads right now, like I forget which actress it was. She's like, I took testosterone, everything's wonderful. And I'm like, that's great, but that's like not realistic for everyone. It's not going to be one thing and you feel great and everything's, you know, fixed. Yeah. I wish it was. It would make my job really easy. You know? Yeah. It's a whole picture.
And I think, you know, talking about the pelvic floor, you'll especially hear it for women who've had children, but I would imagine that could be an issue just for people who are older. We sit all the time. Maybe we have dysfunctional, you know, physical patterns, and that also is impacted. So it's so funny because I have a very good friend who has a protocol for dealing with when the uterus is shifted after pregnancy and just kind of how to get things set back in place in the pelvic floor. And it's some of the hardest exercises, breathing exercises, and kind of holding these postures that I've ever experienced. So when someone comes into you and you sort of get a sense after you get a snapshot, like, oh, we could work on your pelvic floor. Maybe you could just share what's so important about the health and the function of your pelvic floor.
Absolutely. So the pelvic floor, to take a step back, is this bowl of muscles that is in the pelvis that holds up all our organs, right? So it holds up your bladder, your uterus, your bowels. And so it's really important for a lot of different things. It's important for stability because it connects to your bones and your other muscles of your core. So it's part of your core. It's important for support. So it's supporting all those organs. So some people will actually get weak pelvic floor muscles after childbirth and they will have prolapse of those organs. So they'll actually feel like bulging of the vaginal tissues, either below the bladder or below the rectum or below the uterus. And that can happen whether you've had a baby or not. So it can be due to your genetic makeup. It can be due to neurologic disorders. It can be because you have a job where you stand a lot, you do a lot of high intensity exercise. Not that those are all going to lead to that, but those are all risk factors for it happening. So it's important for that. It's important. It's sort of for the sphincter. So the urinary sphincter. So you pee around, like the muscles are around the urinary sphincter. They're around the rectal sphincter. So some people who develop dysfunction, they'll actually contract their sphincter, sort of relax it. So they'll develop like constipation or they'll have difficulty emptying their bladder. They're important for sex, right? Because they are part of our, around the vagina. So when you have an orgasm, those muscles will clench up. And then they'll relax, right? You'll have a big release. And so sometimes if you're having dysfunction, it can be difficult or it can be painful. It can also be painful when someone penetrates for sex, if those muscles are too tight or dysfunctional. So there's a lot of, different ways that the pelvic floor shows up as a problem. You can develop dysfunction for a whole number of reasons. You mentioned some of them, like sitting for long periods of times, people who are really stressed or anxious, or, have like I describe as TMJ, like, you're stressed, you're anxious, you go to sleep, You clench your jaw. You don't know you're doing it. You wake up, maybe you have a headache. Maybe your dentist tells you clench your jaw, and then you go about your life, right? But you don't know you're doing it. It's the same thing. People don't necessarily know they're clenching their pelvic floor, but then they're like, oh, I'm clenching, I'm not relaxing. And they don't really realize it, right? And so they can start developing these symptoms like constipation, urinary frequency, gotta go, urgency, gotta go, back pain, pain with sex, sometimes pain with orgasm. There's a whole host of things that can show up, hip pain, back pain, that can show up because of pelvic floor dysfunction. And so it's important to, when you have those issues, to go to someone who can evaluate your pelvic floor to assess, is it too tense? Is it functioning appropriately? Does it relax when you take a deep breath, or does it tighten up? And how it's supposed to, because then you can go to a pelvic floor physical therapist, like I assume your friend is, who will teach you these exercises like diaphragmatic breathing, or happy baby and child's pose and things like that will really help open and stretch those muscles. But they'll also work with you doing some internal work, like actually massaging the muscles, maybe using different tools like a wand or a dilator, depending on, what's going on with you. Of course, as you feel comfortable. I think people get really scared about that. I was like, no physical therapist is going to force it on you. Like, you should feel comfortable, but those can be really helpful.
Yeah, I think it's such an important point. And sometimes I feel like, too, that would make you lend itself to kind of not breathing deeply if you had sort of some dysfunction down there, obviously. And now all of a sudden you're spun up all day long because you don't ever get to go down into your parasympathetic. And you talk about, the importance of dopamine and serotonin and the interplay with orgasms and sexual desire. So it's funny how when we hear the word stress, we think, oh, I just have to relax. It's like, no, we don't really understand how all of that is so intertwined. Maybe you can talk about the role of dopamine and serotonin in someone's sex life and sexual expression.
Yeah. So, I mean, very simply, right? We have hormones in our brain that are pro sexual desire, and we have hormones in our brain that are like negative sexual desire, right? And so you can have an imbalance of those. When you're stressed, you're going to have more negative hormones that are going to block those positive signals telling your brain, okay, it's okay to feel desire. Like, think about the things you need to have desire and you have to feel safe. You have to feel protected. You have to feel, and modern day stress doesn't make you feel safe, right? Like, we think about safety as like, oh, no one's going to hurt me. No one's going to harm me. But even chronic stressors, I mean, a little bit of stress is fine. We all need a little stress in life, but like chronic stress that people carry in their lives is actually just making it difficult for your body to feel safe. So it's always on alert. It's never allowed to be ready to turn on for sexual desire. So I think that's sort of like the basic tenets. Now, some of the medications that we have for desire, they work on these hormones. They work on trying to basically improve dopamine, turn off some serotonin receptors, turn on others, and really, or by other hormones like melatonin, to really basically improve that availability of those hormones for our brain to use to get more desire. But I think people are going to think like, oh, I take this, I'm going to be great. It's more subtle than that, right? Like, it's sort of like, oh yeah, I used to get really turned on pretty easily by just seeing someone attractive, and now I don't. And now I'm like, oh, I'm watching this show and I'm like, oh wow, that guy's really attractive. Like, it's sort of subtle, Yeah. And I think like we just sort of we get frustrated. We want answers right now. We want to fix it right away. But like, you got to do the work. In fact, there's been studies that have looked at mindfulness. So people, particularly women, who've done mindfulness practices 20 minutes a day, I think it was 8 weeks, and they saw significant improvements in multiple areas of female sexual function. So like arousal, orgasm, desire, all those areas essentially saw improvement. Mostly in desire is the highest change. And these women in the study, unprompted, a large percentage of them went on to continue doing mindfulness because it had so many significant benefits, because they were actually now able to be more mindful during sex. And there's other interesting, like, sort of ways you can hack it. Like, there's one study where they were looking at men who had premature ejaculation, which we think is sort of an imbalance between the parasympathetic and sympathetic nervous system. And so these guys who had premature ejaculation, usually acquired premature ejaculation. They did high intensity interval training for 7 minutes a day for 2 weeks. So just 2 weeks, 7 minutes a day, but they saw improvement in the time before ejaculation after doing high intensity interval training. And the thought is that they're now, during those high intensity intervals, right, they're really aware of their bodies. They're trying to do specific movements in a specific space, right? So they're really like, they have some spatial interoception, and that's then helping them be more aware of their nervous system during sex. And so I think there's a lot of things that we can work on that can really improve ourselves without, trying to go for medication or hormones if you don't want to. But again, I think those are great adjuncts, particularly when we're going through huge changes like menopause, or if you are suffering from low testosterone, if you're a man. I think these can be really, really life changing and transformative for a lot of people.
Yeah, I love that. And do you feel like people are having less sex because of, is it a combination of you were more isolated, we are less social in a real person way, the fact that we hit our dopamine button all day long with our phones, that we sort of have nothing, or we're not looking for that release? Why is it that you think that, or some of the reasons that it's a really different time in the last 20 years that sex is not, what is it, 1/3 of Japanese under 30 are virgins?
Yeah. Yeah. I mean, I think there's a lot of reasons, and it's very multifactorial. When you think about the young generation, right, like they have access to so many people that they can swipe right or swipe left on these apps. And that leads to like this, like, oh, there might be someone better out there. Right. And so that sort of makes it challenging. People have higher expectations of like what they want out of a partner, because this huge access to people. And some of it being like, oh, I'm getting all this attention and I should then therefore be able to get a better person. I think that's part of it. I think part of it is definitely like, look, people go to bed. What are you doing? You're looking at your phone. Are you like cuddling with your partner like you used to? No, you're probably scrolling through your phone before bedtime. Like I bet if people just put their phone away from their bed, they'd have more sex. Like very simple intervention, right? Just don't take your phone to bed with you. You're probably going to have more sex because you're like, oh, what else am I going to do? You know what I mean? Like, oh, I have my partner here, like, that'll help me go to sleep, whatever. And, I think there's that. I think, roles of people are changing. So, women are working full time, taking care of kids, doing all these things, which traditionally they weren't. So they have less bandwidth, right? Like you're doing a lot more. And so I think that modern society stressors are a big challenge for today. I think that the availability of alternative ways to have release, whether it's through pornography, masturbation, it's great. I'm glad people do. But also I think sometimes it leads to like having less sex if you're relying on that primarily. Not all the time. A lot of people who masturbate or use pornography actually have better sex because they're more sex positive or they're more open to sex. But sometimes I think that does happen. So, I think there's a lot of factors and it would be hard to pinpoint just one. But we're in a changing environment, but we have to have sex and have babies to propagate society. So it's a real issue. It's not just like, oh, it's sort of interesting. It's like we need to keep having babies. Otherwise, we won't propagate our society. And we're going to have an aging population with no young people to help take care of them.
And I do feel like we're going to learn, like all this got kind of dumped on us. And I think we're going to learn and hopefully adjust a little bit back to just sort of some natural behaviors that we had. Like we'll figure out a way to calibrate this a little bit, or at least I'm hopeful for that. With men, besides, let's say, having certain comorbidities, what are some of the things that are hard on them or the challenges they are navigating in their sex lives? Let's say with an ongoing partner.
Yeah. So I think, certainly dealing with erectile dysfunction is very, very common. And the issue when you're in a long-term relationship is you start feeling as a man really like having an erection becomes a huge part of being a man to that person because they've always seen it. It's been a huge sign of arousal to them. So when it's not there, one, their partner may respond by feeling like, oh, it's on me, when it's not necessarily, like, oh, it's because they're not interested in me, or they may get frustrated. And so then they're feeling like they're letting down their partner. They feel like they're not, upholding their end of it, which is not necessary, but really they take a lot of feeling in like, oh, I need to have a strong, firm erection all the time, every time. And part of that's society, right? Like we sort of like make it seem like that's always the way it's supposed to be, when like the large majority of women don't even need penetration to climax, right? Like you can stimulate their clitoris without a penis and they will still have climax, right? So I think it's like, that's a huge issue for them psychologically to overcome. And then, I think that's a big one. And then low testosterone, we are seeing more of it. And whether that's due to, I think some of it's due to modern, there's more comorbidities, and we know that men who have more comorbidities are having lower testosterone, but also people are sleeping less. And sleep is a huge contributor to low testosterone. People, are not eating right, exercising. All those things are really important for good hormonal health. And so I think that's a big struggle, because we know how women say they don't feel like themselves when they go through menopause. Men feel the same way when they lose their testosterone. They don't feel as vigorous, or they don't have the same vitality they used to. They feel a little brain fog. They feel maybe even somewhat depressed, and their desire is not there. And so they just but they don't talk about it. Like, I think women talk about these things a little more readily. I mean, thankfully we have social media, and there's a lot of people talking about menopause. Thankfully, finally, I'm so grateful for it. But I do wish that men talk to each other about these issues and had some camaraderie, but they don't. And so I think the real issue is like, men are struggling and they're on an island to themselves, and they're not talking to anyone about it. And so they're not even talking to their partner about it, because they feel insecure, even with partners they've been with it for decades. And so, I think it's, and I understand it. Like, I really do. And I think like me saying, oh yeah, your partner can climax without your penis. Like, yeah, that's a fact, but it doesn't make them feel better. So like, you have to be empathetic. Like, even though we understand that it's not necessary, like for them, it's like a loss of who they are. And of course, like, I do a lot of my work to help them gain those things back, because I realize how important it is. But I think being in a relationship with someone who, if they have that issue, like, you just have to be empathetic. Like, you have to like realize that you may think it's not as important, but it's huge to them. It's a huge issue, and they're really dealing with it.
Yeah, it's a great reminder. What's the average size penis? I think everyone thinks, like, when we talk about porn, like, oh, it's like that. And the reality is
yeah, it's like somewhere between 5.1 and 5.5 inches, depending on, where you're located in the country, which study. But yeah, it's not 12 inches. It's not, not even 6 inches. And so I think like the large majority of my patients, I'm like, you're average or above average, like, you're fine. Even if you're slightly below average, you're fine. Like, it doesn't really matter. But I think the issue is that, people will joke like, oh, this guy had a great big penis. Oh, wow, you're so lucky. Oh, this or that. Even I've caught myself, like, I was on a podcast and somebody was saying, and I was like, oh, wow. And I didn't even realize I did it. It's like so ingrained in society, right? Like that you should like be so enamored by a large organ, but it's like literally not in their control. It has nothing to do with how good they will be in giving you pleasure. And like, it's just not, sometimes it's painful, right? There's actually products available on the market now, like it's called O-Nut, where the male puts it on his penis so that he's not penetrating the full length of the penis into the partner because they're too big. And so I'm not sponsored by this product by any means, but like, we have it, right? Like these are tools we have to make sex more comfortable for women. And it makes sense because the average vaginal length is about 3.5 inches. And that may, increase in length and width when you're aroused, but it's certainly not going to be 12 inches. Like it's certainly not going to accommodate a very large phallus. And so it's more of just like some people fetishize it. I mean, some people do enjoy cervical stimulation because they do climax that way, but that's a really small subset of people. And so I think really, just people knowing that like they're average, above average, even below average, it doesn't matter. What matters is that you're having pleasure, your partner's having pleasure. That's it. That's all that matters. Like no one else matters, not what they think, not what they say. Like it really doesn't matter. So I think that's what's really important.
I agree. I mean, like, what do we, besides if someone's choosing to have children, that's, I think, part of the way. It's a way to connect. It's a way to have fun. And what about, when I think people have these myths too about duration, how long does it take for the average male to have an orgasm and for female?
Yeah. So for the average male, what they measured, they did this study where they had women use a stop clock. And so they penetrated and they started the stop clock. And when they orgasm, they stopped the stop clock to see how long it took, which I was like, I'm just trying to think of like how that would work, but they did it. And so they got on average around 5 minutes or so. So the magic number in urology is 5 apparently, but like around 5 minutes. And so, maybe it was like 6 or 8 minutes and up to 10 minutes in the UK and like, a little less in Turkey. I forget what it was, but around the world on average, it was 5 minutes. And so, the average guy doesn't take very long, but for the female by herself, it takes about 8 minutes. With the partner, it takes about 14 minutes. And that's, just to say that like, if you have sex and the only thing you're focusing on is having the male orgasm, it's very unlikely that the average male and the average female, that the female will climax during partnered sex. And so you need to sort of offer a little bit more stimulation. And it also takes time for women to get aroused. So the average time for arousal is even longer. So that means like foreplay and all the other things that go up to it, it can take up to 25 minutes. So really like you got to sort of factor those in. There are some biological differences between men and women. So if your goal is to pleasure a female, you have to prioritize foreplay, take your time. And it is possible to climax together or whatever you want, but you have to sort of figure out how long it takes your partner, how long it takes you, and realize like sex is just like any other skill, right? Like if it's getting your partner to climax, getting yourself to climax together, whatever it is, like it's going to take practice and it's going to take communication. Like you have to talk to each other or at least give nonverbal cues about like, is it good or bad? Or, are you on the right track? It doesn't always have to be like, yeah, you don't always have to like give a speech, right? But I think like there has to be some conversation about what you like, what you don't like, and what's working and what's not, and not take it personally. Like you're just figuring it out. You're figuring each other out. And you can still do that decades later. You might find something else that you've never tried that was really fun, right? Like that works really well, but you've never tried it before. And that's okay. I think realizing like sometimes it won't work. Sometimes there'll be something you try and like, oh, I did not like that. And that's okay, right? Like, so what? You tried something. Like it's not a big deal. So,
Is there a difference between an orgasm physiologically as far as like benefits to your health or your body with a partner or through masturbation, or is it the same? Do we know? It's pretty similar.
It's pretty similar in terms of like what happens to your brain. Like your brain just knows that you're having like this, it's very similar. So essentially when you're, for example, watching pornography and just watching it, not doing anything, there's a slight increase in activity. When you touch your genitals, that increase in activity goes way up. And then when you have sex with a partner, it goes a little bit higher. So you're having like an increase in activity in your brain, and then you have an orgasm, and very quickly your dopamine drops and your prolactin goes up, and your brain does sort of the same, very similar things in terms of like what's happening in your brain. And so I don't think it really knows much of a difference. Like, yes, there's other factors when you're with a partner, right? There's going to be the smell of your partner. You're going to be touching different things. So it's going to light up different areas of the brain a little bit because there's like another person there. And so that can be, and there's also the element of like, someone else is touching you. So there's that element of like, I don't know what's happening. And apparently there's like receptors on your skin. They actually only respond to human touch. So even if they put a gloved hand on someone, those receptors won't light up. So there are certain areas that are like very specific to human touch that do light up. And so I think, yes, there are differences, but ultimately very, very similar. I wouldn't say they're like largely different.
Yeah, there might be some single people out there who are like, yay, at the moment. Do you?
Yeah.
There used to be myths about, especially boxers, like no sex the night before and all of that. Do we see performance diminishing or improving either, in the output area of the gym or the boardroom that are connected to having sex or withholding?
Yeah, so there's actually been some studies on this. So this actually comes from like Greek mythology or something, where they used to say this to, or not Greek, Roman times, I think it was, where they would tell like people before they were going to go to these big tournaments, like don't abstain from sex. And so that's sort of, made its way through society. And so, yeah, there are people who believe that like your testosterone goes up, when you don't have sex. That's actually not true. And so they've actually done studies on this, which, believe it or not, and they've not seen this significant increase in testosterone by abstaining from sex or any change in like performance, sports performance. And they've looked at, I think it was like cycling and running and different things. But they haven't seen any difference whether you abstain or don't. And so what I tell people is like, do what you're used to doing, right? So if you always have sex every morning, like you should have sex in the morning because that is your normal routine. If you disrupt your routine, that could actually have negative implications. Whereas if you don't usually have sex and you don't have sex the night before, fine, like whatever. If you notice a perceivable benefit, like try it, obviously not on game day, maybe try it at practice. And if you notice like, oh yeah, I feel like I have more energy, or I feel I perform better on the field or whatever sport you're playing, go ahead, abstain, but like test it out before you like mandate every person on your sports team from abstaining from sex the night before a performance, because it actually could have negative outcomes. Like if that person's body is very used to having a release, they could have bent up, pelvic floor tension, and they're not going to perform as well because they've now not released like they're used to releasing.
I love that. But it's such a big thing, like, especially with boxing, they're always like, no women at the training camp, but that's maybe for other reasons, I would imagine. When we talk about like sleep begets sleep, like try to go to bed around the same time and, those kind of patterns. I can tell you as a married person who's busy, like most people are, everybody's working and running around. There is an element of scheduling that goes into some of it where these windows that you're going to have. And I know at times it feels very unsexy, but it feels also like if you can stay in the rhythm, it keeps the rhythm. It makes it easier. Cause I've been in phases in my marriage where it felt like one person's waiting and the other person's feeling the stress of the other person waiting for it, where if you can find those windows. So I know a lot of people think, oh, well, it's not sexy to schedule it. It's like, well, it's not, but maybe it keeps that loop, that momentum going. And I think for a lot of females, it's like, you don't ever feel, and I put that in quotes, like getting into it. But once you're there, you're so happy and you enjoy it and all these other things. I don't know. How do you feel about that? Because I'm sure that's a conversation a lot around fitting it in.
Yeah, people hate scheduling it for whatever reason, but I just remind them, like when you were dating in high school or college and you didn't have you didn't have the benefit of having a partner next to you all the time, you would go on dates, right? You would be like, oh, like we're going to meet on Friday. I'm going to shave my legs. I'm going to look pretty. I'm going to smell good. I'm going to do all these things. I'm going to, we might have sex, like, oh, it's going to be real fun. And so you would get excited, right? You would be like, oh yeah, this is going to be so fun. And even if you didn't have sex, you still had a good time, right? Like you still were together. You might have fooled around. You might have, been close. And that's what it should be, right? Like you are just scheduling time to be intimate, right? And I think we schedule time for date night all the time, right? Everyone's like, oh, I go on 100 dates a month. I'm over exaggerating, but like, I always have a babysitter lined up. I go on date night all the time. And I'm like, okay, just take one of those date nights and make it a sex night or an intimate night, right? Like a night where you're focusing on being together, right? It doesn't mean we have to go out and eat a fancy dinner and be bloated and whatever. It's like, we're actually just being together and being intimate, and like there's no surprises, right? Like we know like being close and being physical is on the table. Now sex doesn't have to be on the table because that can sometimes be stressful for either party, right? But it's just like, I'm just going to be close to you. If sex happens, that's a great bonus. But if not, I just want to prioritize physical closeness. And I want to make time for it. Because yeah, and sometimes people are just like, their libido is higher in the morning. Some don't like morning sex. Some, there's like a whole bunch of things that makes it sometimes difficult. But like this way, there's something that's on the calendar that you look forward to. I mean, we schedule brunch dates. We schedule our gym workouts. There's so many things we schedule. Like, why can't you schedule an intimacy night with your partner? Like, it's it's just another date. Just think of it as another date. It's just not your traditional, let's go to a movie or have dinner. It's something different. It could be even a physical activity, right? Like where you get your heart rate up, you get your, because then you sort of are priming yourself. You're doing the same thing that happens when you have sex, right? Your heart rate goes up, your blood pressure goes up a little bit. Like all those things are what happen when you're aroused. So you're sort of like priming your body for potentially having sex later.
Well, Dr. Malik, I could talk to you forever, and I would love in another time to get even more sciencey and geeky, but I just wanted to open up the conversation because it's something on everybody's mind. I was thinking about it when I was doing this interview because you have such an ease and such a comfort about it. I was wondering, what do you think for your husband? Like if you go to a dinner party, for him, is he like, oh, here we go? Like, I'm just curious, like what has become interesting? He's like, I was marrying a girl who was becoming a doctor. Right. And, and you are, but now everyone's like, let me ask you something. I'm just curious if you ever go, this poor guy, he just rolls with it.
No, fortunately, he is very secure and he thinks it's hilarious. Like I just had my 40th birthday and he was like, I really want to make some jokes about urology, but like there was kids in the audience. So he's like, I can't make the jokes I want to make, but he's very comfortable with it. And he knows like, he doesn't even like really think too much about it. He's very supportive. So yeah, fortunately I have a very supportive understanding and he's hilarious. So he just thinks it's funny. Like a lot of the stuff, like he just makes jokes about it. So it's good.
When you went to school and you thought, okay, this is going to be my profession. What were you hoping, like for your own personal mission, what were you hoping to contribute? And then how has it shifted and changed? And what are you hoping now?
Yeah, it's changed a lot. So I went to residency. I didn't know what type of urology I was going to specialize in. In fact, I didn't want to do anything to do with female urology because I was like, oh, I'm a woman. Everyone expects me to take care of women, and I don't want to do that. So I did that. Then I went into, it's all about the mentors you meet. So I had this wonderful, amazing mentor who did reconstructive surgery, and I just fell in love with the surgery. And so I did actually a female pelvic medicine and reconstructive surgery fellowship, where a lot of what I did was taking care of women with prolapse and incontinence and men and women with voiding dysfunction or bladder problems. And then as I went into practice, you sort of like your practice evolves based on what's available to you, what patients come in to see you. And so I started taking care of a lot of men with sexual dysfunction as well as women. And I realized like, one, we knew very little about women with sexual dysfunction. So I really dug in there because I was like, these women, first of all, there is no ICD-9 or 10 codes for female sexual dysfunction that are covered by insurance. So like women come to you with a sexual problem, they can't get it covered by insurance. So I was like, oh my God, this is horrible, right? And then these women are just told like, have a glass of wine and like, deal with it, right? They're having issues with sex. Oh, I don't know what to do. And I was like, that's not acceptable. Like, that's just not okay. So I think from there, and then also starting my social media, which was really like, I just felt bad for patients who would come and wait in the waiting room, find parking, and so spend hours coming to see me. Some of my patients when I was at Maryland would come from like the Eastern Shore and they would drive hours to see me. And it would be like, I would be counseling them on like very simple lifestyle things. And I was like, they don't really need to come here. This was before COVID. So telemedicine wasn't really a big thing. And I was like, this should be information that they should be able to look up at home and find and not have to like come see a doctor for. So that's sort of how I started my social media platform. And then as I saw people's response, I realized like there is no sexual health education around the world. It is horrible. And I was like, this is an opportunity that I can really teach people about their bodies. And I had no idea that it would become this big thing. But it was just like this really, internally derived mission. Like I wanted people to feel comfortable in their skin and be able to find answers that were by doctors, not like people who were like selling them a nitric oxide booster or selling them some course or, something else where they had a financial incentive, right? Like I just wanted to teach people. And I thought that, it's been so meaningful. Like as I've done it, I've seen how many lives it's touched and how people will come up to me like, my marriage is so much better because of you. My life is better because of you. Like my partner's really happy because of you, like whatever it is. And it's just like really, really wonderful. So it evolved, but you just kind of go with where it takes you.
Well, I really appreciate it. And let's say somebody hears this and they go, okay, I'm going to start with the lifestyle changes first. I'll look at my food and my movement and be more mindful and, get out in nature, just relax, try to de-stress a little bit. And then if they've had some of the hard conversations within the relationship and maybe things are still at a crossroads, what invitation would you make for people that they're still not kind of getting to the bottom of it? What's the best first starting point?
Yeah. I mean, I think like you mentioned, I think saying these things, lifestyle changes are really easy, but they're really not, right? So I would say take one thing at a time, make a small change, like the Atomic Habits, read that book if you haven't read it, and make small changes to get you to where you want to be in those individual areas. So, pick one thing. Don't do 4 things. Like I'm not going to like go out in nature, go to sleep on time, eat right and exercise. Like you'll give up because it's too many things to do. So pick one thing, start with it, work your way through that. Once you've got that down, add the next thing. And you're capable of more than you think you are. So that's one. Second is if you're still struggling, like don't suffer in silence. Go see somebody. Like it is really, it is worth it to take the time. First, research who you're going to see. Make sure there's someone who's an expert in sexual health because a lot of people don't know, and not by any fault of their own. They weren't trained or they don't know enough about sexual health. So you'll go and end up feeling disappointed because they're just going to say, here, take some Viagra or here, to have a glass of wine or whatever. They may not give you a full cohesive discussion, and not because they don't want to help you, because they just don't know how. Yeah. And so find someone who's an expert. You can go on the Sexual Medicine Society of North America website if you're in North America, and you could find an expert near you, or you can go to the International Society of Women's Sexual Health website, and you can find someone on women's sexual health, and find a provider near you who will see you, who you can talk to. And on the Ishwish website, you can find sex therapists. If you're dealing with physical pelvic floor issues, you can go to it's pelvic. I'll send you the links, but there's some pelvic floor websites that you can use. Herman Wallace, I think, is one. APTA is another, where you can find a pelvic floor physical therapist near you. So many options for you. If you want to see me, I'm widely available. I'm obviously in California, seeing in person in Beverly Hills and Irvine, but also I'm telemedicine for 7 states. So New York, Maryland, Virginia, Texas, Illinois, Florida, New Jersey. I think that's it.
So do they just go to your website to find you?
Yeah, absolutely. On my website, renamalikmd.com/appointments. And I offer in-person, virtual. And if you're not in those states, I can see you for an educational visit, just like talk about issues so you know what to ask your doctor. So lots of options, but I would say like see someone. It's worth it. And you're worth it. Like really, you are absolutely worth the time of investing in your sexual health. It matters. It's important. And having pleasure is underrated. Like people deserve pleasure, and you deserve it too if you're struggling.
Well, Dr. Malik, I really appreciate your time. And you mentioned something at the top of the conversation, which will make up my final question. You talked about how culturally you guys, your culture wrote the Kama Sutra, and you'll see in there that they sort of say, hey, there's X amount of body types and shapes, whatever that is. And that especially men get older, they should ejaculate less. Is that a myth? Do we know if there's anything to that there's something to be said for not ejaculating as often when you're older?
No, there is really no evidence to support. There's a lot of people touting no nut November, semen retention. Like if you derive pleasure or if you derive benefit from avoiding ejaculation, by all means, like, go ahead, right? But you can also harm yourself, right? You can develop pelvic floor dysfunction because you're tensing your pelvic floor to try to avoid ejaculating. You can develop blue balls because there's, blood flow getting congested in that area, causing pain and discomfort. Or you can just be very shameful, right? You might have a wet dream and then you're going to be like, oh man, I messed up. And then you might feel shame, like, oh, I'm a horrible person. I couldn't do it. And so I think that, do what feels normal. There's actually evidence that ejaculating 21 times or more a month is linked with a lower rate of prostate cancer. Now, I'm not telling everyone you should ejaculate 21 times a month, but I'm saying there's evidence that maybe ejaculating more often may be beneficial. So there's no harm in ejaculation. There's no harm in it for the large majority of people. Ejaculating, masturbating, having sex, it's all fine if you start having issues. Some people, as I mentioned earlier, do have issues where they habituate to a certain type of stimulation. Yeah. That's rare, right? It's not that common. It's if you do it the same way every single time, and then when you're with your partner, you can't because you're so used to that one stimulation. We can work through that. But for the large majority of people, masturbate, have sex, don't worry about it.
Yeah. Well, Dr. Malik, thanks for your time. And, I appreciate the tone in which you set the table for this conversation. I think it's going to help. And has helped so many people. And your family is lucky. Your sons are lucky to have you.
Thank you. Thank you. Well, thank you so much. This was a lovely conversation. I hope your audience really enjoys it.
Thanks. Thanks, everyone. So thanks again for joining me and listening to The Gabby Reece Show. Make sure to like and subscribe so you never miss a conversation. And if anything showed up today that you find would be helpful to someone you know, pass it along and make sure to share with us what really resonated and stood out for you in this conversation. Thanks again for joining us. Keep going, and I'll see you next time.